Okay, so MJ already been roomed by our other medical assistant. She already been through the process. The provider came and looked at MJ's staples in here. She confirmed it that they can go ahead and be removed. But as a medical assistant, I want to make sure that I do my part as well. I came to my patient room. I confirmed my patient identification. I reviewed her chart. Her chart said that she had 10 staples right on her forearm. Hi MJ, how's it going?
Pretty good.
Awesome. So can you confirm that how many stitches were put in on your arm?
There was 10 stitches.
Okay, how are you feeling?
It itches, I'm not gonna lie.
Okay.
It's painful.
Okay.
It hurts.
All right. So have you ever had stitches, sutures or stitches removed from any part of your body?
No.
No. Okay, so what I'm going to do is going to clean them a little bit first, and right after cleaning them up, I'm going to start taking them off. It is going to be a little bit, it's going to be hurt a little bit, but if it hurts you a lot, let me know. I'll stop and then I'll talk to the provider. Okay? In this, I have some alcohol wipe, and your chart says that you're not allergic to anything. Is still correct? Okay, perfect. So the way we clean is we start from the middle, and then we work our way out. So I have my alcohol wipe. I'm just gonna go ahead and get this started, and we're just gonna ignore that there's a whole bunch of staples on MJ's arm. We're just gonna focus on these 10. One more time to be safe. Anytime we remove stitches or staples, we're gonna make sure we start from the middle. Staples on the skull or head, it will be a little bit hard because there's going to be hair, so we might have to like move the hair a little bit and give them a heads up that you're gonna try your best not to hurt them. But if it pulls the hair with it a little bit, you want them to know that you're not. So as we are trying to remove the staples, we want to make sure that we place the 2 teeth of the staple remover under the staple, and the 1 teeth goes on the top, and press down. Handle, pressing it down before I do anything. When I press this down, the corners of the staples, these are not the best kind. These are just for practice purposes, and the real ones has kind of like notches at the corners, and then when you press this down, it kind of like opens them up. So as I'm taking any staples out, I'm gonna make sure to place them on my gauze right next to me for my documentation purposes. I do not want to throw that away until I'm entirely done and counting. And here we're gonna now we're gonna rotate one from the top, one from the bottom, and we're gonna go one in between. Again, the same reason, in case the wounds were not healed and it's about to open up, then I'm gonna stop and get my provider. And as we're going, we just check on our patient too, that how's she doing. Now that they are all done, I'm gonna observe the area. I'm gonna make sure that I have all the information I needed. My pre-observation was that they didn't look red to me. It did not have any pus coming out, and my post-observation is that she still doesn't have any redness, any swollen around it, and there's no pus coming out. So what I'm gonna do, I'm just gonna clean it one more time, and for my documentation purposes, I'm gonna make sure that patient is doing okay. And it is not always required to wrap it, but if your provider says that after you take them out, wrap it or put a bandage, that's up to the provider. If the patient wants it, we can put it as bandage or wrap it with a gauze or bandage, whichever is best required. But the most important part for the documentation is going to be, per provider, 10 staples were removed from patient's right arm. Patient tolerated well. There was no redness, no discharge, and no questions. The reason we want to do that, in case
the provider put 10 staples on the patient when at the beginning, and now she's here for 7 of them. We want to make sure we document it. So let's just pretend that MJ here came forward with 10 staples at the beginning of her injury, and now for removal she has 7. So MJ, can I ask you, your chart says there's 10 staples, but now I see only 7. What's the reason?
I was itching it, so it kind of like came off.
Okay. Okay, so now my documentation is going to be that patient had 10 staples on her right arm. She came in with 7 per patient. It was itchy, and as she was itching it, they came out. But it was confirmed by the provider to go ahead and remove the rest of them. It is very important to inspect the area before getting the staples or sutures out and after for the document purposes. And we're gonna write the amount of stitches were out. So if my patient was 10 when they were putting at the beginning, and now she came with 10, I'm going to say 10 out of 10. But if she had 7, she had 10 at the beginning, but she came with 7, I'm going to document that 7 out of 10 and the reason that she came with 7 of them. And that's it. Thank you, MJ.